Alright guys, today we're going to zero an A-line. Okay, so we have our A-line set up here for the patient. Some of the first checks you're going to have for this left radial A-line is the bag. So the first thing, you want about 500 cc's of saline in your pressure bag to 300 psi clamped on. Okay, down through, no air at all the way through before you connect to the patient, all the way through the setup. Okay, for transport, to keeping the phlebostatic access, so level with the left ventricle, the easy way to do this is just to tape it to your blood pressure cuff the way you would regular NIP blood pressure. This is the easiest way to correlate your blood pressures with your non-invasive and your invasive and keep it with phlebostatic access and transport. Following down, again, no air bubbles all the way through. You want to connect it to their left radial stylet here where it was at, and then we can make sure all the valves are closed. Okay, so now for zeroing with the Propaq, once you plug in the pressure cable to the actual device itself, it automatically registers in the Propaq we have in our MES kits. You can see it here, the flashing of the zero line. Okay, so to zero, we're going to go ahead and locate our pressure 1. Okay, and over here we want to turn it off to the patient, so follow it down to the patient, off to patient. We're going to open the cap. Because this is at 300 psi, I can set it down and there's no issues. Okay, we're open to air, off to the patient. We're going to press the 0 button here. It's going to tell me it's zeroing, and we're going to wait for 0. It is zeroed. We're good. I can now come back over, put my cap back on, open it up. At this time, if you had the actual art line in place, you would see the waveform here coming across. Okay, you have a blood pressure. We're going to flush it, pull back on the tab, release, and we're going to look for the full section here. So we talked about dampening, under dampen, over dampen. As long as you have a nice, good couple of squiggles and back to a good clean waveform, you're doing okay. Sometimes with these patients, especially if they're put in hastily, you may have to straighten the wrist or manipulate the wrist to get a better reading and a good clean waveform with those dichrotic notches and everything. So that is zeroing an A-line.